Hello all, welcome to PharmaNandan. So let us start our first MCQ in ANS Sprint series, right? The question is as follows. A 28-year-old female, she was brought to the casualty by attendants with complaints of severe abdominal cramps and vomiting. Okay, her attendant reported that she ingested few ml of organophosphorus compound poisoning. Why? To threaten her husband as a suicide attempt. Okay. The physician observed all of the typical symptoms of the patient and it came to be acetylcholine excess activity. So which of the following symptoms in the following options will are correlating with the activation of NM type of receptors only. They are not asking about other receptors, only NM type of receptor. So before solving this MCQ, let me reframe it, zoom in the photo. Okay. The symptoms which are caused due to activation of NM receptors only. Okay, where are NM receptors located? Actually, NM receptors are located only in the motor end plate. Okay, motor end plate only. That is, in this question, they are asking something related to skeletal muscle only, because motor end plate is the thing which we see only in the skeletal muscle. Okay, this is the schematic diagram, not original picture. Okay, let us say this is nicotinic channel NM receptor. Okay, this is NM receptor on which acetylcholine is released, which acts on it. Okay, thereby causing opening of the channel, causing influx of sodium into the cell. We call it as depolarization. What happens after influx? After certain threshold is reached, certain threshold amount of sodium is reached inside the cell, and voltage difference will occur here. Because of voltage difference, there will be again influx of the sodium channels, sodium ions in the neighboring ion channels, right? We call it as nerve conduction. These are involved in nerve conduction. This is involved in the depolarization. Okay, the thing with acetylcholine is very short acting. Right, what happens when it is short acting? Once there is depolarization, there is deconduction, and this acetylcholine activity will be stopped because of rapid depolarization. But in organophosphorus poisoning, there will be excess amount of acetylcholine activity here, excess amount of acetylcholine activity. So it keeps on stimulating depolarization here. That is, depolarization is continuously happening due to continuously activation of the nicotinic NM receptors. We call them as NM receptors here. Okay, due to continuous activation of NM receptors is happening here. But due to continuous depolarization, this voltage sensitive sodium channels, there are here, right? These voltage sensitive sodium channels, they stop working because they will work only for brief period once there is depolarization. When the depolarization is repetitive and continuous in excessive amount, these voltage sensitive sodium channels become inactive. We call it as depolarization blockade. Keep in mind, here there is excess activity of acetylcholine. NM receptors are being constantly activated. Activation of NM receptors are there, but inactivation of voltage sensitive sodium channels are there. You should be very well about the difference between these two. There is activation of NM receptors. Here, activation of NM receptors, inactivation of voltage sensitive sodium channels. Agreed? So we can see paralysis of skeletal muscles only during this excessive activity of acetylcholine in the NM receptor. Activation of NM receptors only. So where are the skeletal muscles involved? For example, if the skeletal muscles are involved in the eye, extra muscles, that is extrinsic muscles in the eye, we can see there is diplopia in the person due to paralysis of extrinsic muscles in the eye due to activation of NM receptors, but inactivation of voltage sensitive sodium channels. Same thing happens with swallowing also. What happens here when there is paralysis of striatal muscles in the throat? Okay, that is the pharynx, what happens? There will be activation of these NM receptors, inactivation of voltage gated, voltage sensitive sodium channels. Paralysis occurs. So these are the two symptoms which are involved with the only NM type of receptor activation, causing inactivation of voltage sensitive sodium channels, thereby arresting the conduction of the nerve impulse, leading to paralysis of skeletal muscles. Understood? So the difficulty level is actually hard, but if you know the basic, fundamental basic, very easy to solve this question. I think you understand the concept, right? You understood the concept. So the right answer is option E. And well, thank you for watching and see you soon in the next video. And thank you again for watching. See you in the next video.